everyone. My name is Sue Ross, and I'm Director of Admissions for Tulane University School of Public Health and Tropical Medicine. And today I have Dr. Mark Del Corso, Clinical Professor in Global Community Health and Behavioral Sciences. Dr. Del Corso, would you like to introduce yourself?
Okay, sure. Thanks, Sue, for giving me the chance to do this. And my name's Mark Del Corso, and I trained here at Tulane a long time ago in my residency. So I was just going to mention a little bit, where I'm from and how I got interested in public health and kind of mix my training in with that. But I'm from Southern California, went to college in Southern California, University of California, Irvine. And during that time, we had a course called Health Science Experience, where we spent time in hospitals and ICUs and that kind of thing. And really, instead of really enjoying everything I saw, I felt like medicine needed to become more preventive, and physicians should spend more time trying to help people stay healthy rather than just treat disease, because once you have chronic diseases, it's really hard to overcome those. So that got me interested in preventive medicine. And then I went to medical school in Mexico, and we had a lot of clinics where we were kind of in the slums around the periphery of the city, where people were living in really poor conditions, so a lot of malnourished kids, a lot of diarrhea, dehydration, things like that in children. And that showed me the importance of public health and community medicine, and kind of combining clinical medicine that people are really interested in with public health approaches and community health approaches. So I came here to Tulane back in the 80s and did a residency in pediatrics, and then a residency in preventive medicine, where I also got my master's in public health degree here at Tulane. And since then, I've been trying to combine clinical work with public health practice.
Okay, well, I really wanted to invite you here to talk about the joint MD-MPH program, because you are the lead faculty for that program in Global Community Health and Behavioral Sciences. Can you give us a brief description?
Sure. So that program is part of the overall MD-MPH program here at Tulane. And a student, if they're accepted to the School of Medicine and they have an interest in public health, preventive medicine, just kind of improving health outcomes in general, can apply to the School of Public Health and do the dual degree. And so in our department, it mainly focuses on community-based interventions of what a physician could become involved in to try to help prevent disease outside of the clinic, getting involved in like school-based clinics, school-based prevention programs and things like that. And the courses that they basically take those courses 2 afternoons a week, and then they have to take some courses during the summer. And most of the students do the 4-year program, where they finish both their MPH and their MD degree within the 4-year period.
Okay. I understand that it's the largest MD-MPH program in the country, and you mentioned that it could be concurrent. So there are options of concurrent or 5-year program. Is that correct?
There's options. Some students will decide maybe after their 2nd year of medical school to take a year where they just take public health coursework and work on their public health practicum and their thesis or public health analysis paper. And some students opt to just get a certificate, which is a public health certificate, where you take, I believe, 15 or 18 credits, and you get a certificate that shows that you have some core knowledge in public health areas. But most do the dual degrees in a 4-year period. And our program is, you could say it's the more generalist public health master's within all of the programs that the medical students can do. And I recommend that approach because when you finish medical school and you begin your clinical work, it's different for every physician how they apply their public health training. And so having a really broad public health base in all of the areas of public health, I think, is a benefit.
Well, it's very nice to hear that there are options. Mm-hmm. So this is a joint program, which means that some of the credits will count for both your MD program and your MPH. Can't you give us a little information about that?
So a student without a medical background, I believe they need 45 credits to get the MPH. Those who have a medical background need 42, And so medical students are able to pull 10 credits from the School of Medicine on courses that they take already about epidemiology and things like that. And so they need to complete 32 credits during that 2-year period while they're getting their MPH degree. So they do that, like I mentioned, during the summer, and then a couple afternoons a week. And then during their 3rd and 4th year, they complete a project in the community, and they also write a public health analysis paper, which is part of their degree.
Okay, and what about the application process? Can you describe that?
Okay, so just like any medical school, the students would go through the regular medical school application process where they apply to a number of schools and interview at those schools. And then once they're accepted at the School of Medicine here at Tulane, then there's just a supplementary application where they write a brief summary about why they're interested in public health. And then we look at their grades and basically their MCAT scores and that kind of thing, and then usually just accept them into the School of Public Health, into the particular program that they're interested in.
Okay, so great. So no added interview?
No, they don't have to come back for an interview or anything like that.
And what information will these students be learning in community health sciences?
Okay, so like our program, as the name indicates, it focuses on community. So I think probably the best way to describe it would be physicians who are involved at the community level, say primary care physicians and family practice, pediatrics, things like that. They often see recurring problems in their patients, which they can't solve in a clinic visit. They can't solve it with a prescription. And so in our department, they learn how to plan and put into place programs, policies, interventions, maybe at a community level, like a school-based education program, or other types of projects that could be put into place either at a community level, state level, to address health and to kind of get at the root causes of disease. So they're learning those skills, how to plan and put into place programs.
Great, so that leads into my next question. I was going to ask, what would be the benefits of doing a dual program like this?
Okay, so I think, from the point of view and just looking at my own life, I mean, there's two aspects to, I think, how it can improve what you do professionally and really in your own personal life and development. Personally, it's a benefit. Like there have been many times where I professionally am seeing a lot of patients, and then there's other times when I've worked in more public health settings, and then there's times like now where I see patients half-time and I teach public health half-time, and there's been times when I've worked for the state health department. So it does give more variety to what you can do, the skills that you have, so that you don't have to just see patients 40 hours a week in order to do what you want to do professionally. And then more, looking at health outcomes, it really gives you a perspective on, what causes people to become ill, what are their behaviors, what are things in society as far as discrimination, as far as low socioeconomic level, other things like that that affect people's health, and how you can have an effect on that by doing public health programs. So to me, it's a little more rewarding than just doing clinical care, because you're actually addressing the things that cause ill health in people and populations.
Yes, I guess it does give you that different perspective than you would get just by medical school alone.
Sure, in medical school you're going to focus mostly on diseases, learning disease after disease of different systems of the body, how to diagnose those diseases, and then how to treat those diseases. And so your focus is really on illness in medical school. And even though they are, of course, emphasizing more on prevention and on education and that kind of thing, it's mostly focused on disease, whereas the public health aspect helps you to focus on, not only what's going to cause people to become ill, but what's going to cause people to become healthier, and you can focus on those things, which make it more interesting.
Fantastic. Now, I know it must change from year to year, but about what percentage of the incoming medical school class takes advantage of this joint program?
Sure. It's about the same from year to year. It varies a little bit, but about 25%, 1 out of 4 of the medical students is actually in the dual MD MPH program. It's about 50 students a year, and those are distributed throughout the programs here in the School of Public Health, and that's out of about 190 medical students in each class in the medical school.
Wonderful. I'm glad such a percentage does,
Mhm.
they do take advantage of it. Well, I would like to ask a few questions about you.
Okay.
Since you said that you came from California and then Mexico for training and school, how is it that you wound up at Tulane? What attracted you to come to Tulane as your employer?
Okay. Well, I mean, originally, with the education that I got training in a medical school in Mexico and kind of seeing really the effects of poor community development, low socioeconomic level on the patient populations that I had there, I really became interested in public health because I felt like it was addressing the root causes of ill health in people. And I knew that Tulane did have a School of Public Health and Tropical Medicine, which is known all over the world. And so I did end up coming here through the match to do my residency programs in pediatrics and then in preventive medicine and trained in public health also. And so after that, I ended up working for the State Health Department here in Louisiana for a while in their HIV/AIDS prevention program. That was back in the 80s. And then worked for a mission agency in Central America for a number of years, training community health workers, doing community clinics and things like that. And then I came back to the U.S. to work in a community health center here in New Orleans. And so all of that, you know, showed me the value of combining community and clinic, and I wanted to be able to transmit that to students who have the same interest and give them the skills to address those issues.
Well, you are truly a valued member of our faculty here.
Thank you.
Okay. Well, if anyone wanted to get further information about the program, to whom should they direct their questions?
Okay, so there are a number of programs within the MD-MPH program, and so if you have general questions about the program in general, it's good to contact the program director, who's Adam Mace, and he knows what the students do in every program, what kind of emphasis each program has. If you want to do clinical trials as you get through with your training, if you want to become involved in health administration, things like that, he can kind of orient you as to which program would best fit your needs. And if you do have an interest specifically in community health and community health programs, then you could communicate with me and we could talk about what your interests are.
Okay, and I will be able to share that information on our website. Well, thank you, Dr. Del Corso, for joining us today for this interview. I enjoyed chatting with you.
Okay, thank you so much.
Thank you, everyone. Bye-bye.
Bye-bye.